listen to. Dr. Li Wenliang of Wuhan Central Hospital was the whistleblower. In December, he had been told by police officers in China not to spread fake rumors after alerting his friends to a new emerging virus. On February 7, 2020, that same virus tragically took his life. His death sparked a wave of anger, grief, and overwhelming sense of mistrust toward the government. It also exposed the great cover-up of China, in which Beijing punished the informer, claimed U.S. troops started it, and is still lying about death and infection figures. China is not the only nation whose government is lying. The fault for the most catastrophic pandemic to hit our species in living memory, the impact of which will be felt for generations to come and across all levels of society, does not lie solely with Beijing. And neither does the cover-up. As you will read, governments in the West, specifically those of the United States and the United Kingdom, have blood on their hands too. Through arrogance, through complacency, through fear of looking foolish, through stupidity, and through greed. What lessons can be learned? The life and death of Li Wenliang is a critical reminder of the need to speak truth to power. Whistleblowers like Dr. Li demonstrate guts and integrity when so many go with the flow or look out for number one. He was one brave doctor who tried to warn the world, was silenced through coercion, yet was still able to make a difference in the most inspiring of ways, even as he lay on his deathbed. Throughout history, we as a society have benefited greatly from the brave exhibitions of character of men like Dr. Li. Wars have ended, lives have been saved, governments and corporate titans have been held to account. Don't let Dr. Li's example be lost. Amid the bluster and buck-passing of governments in the West, remember the simple truth of what he tried to tell us. Listen to the experts. Look at the facts. Remember that, as humans, saving human lives should always be our priority. Dylan Howard and Dominic Utton, June 2020. A note on the numbers. Where statistics for infections and deaths from COVID-19 are quoted throughout this book, we have used figures from worldometers.info, an independent source acknowledged and trusted by governments and news outlets around the world. A word of caution, however. Much of their data is in turn supplied by official government bodies. And, as we shall see, official government bodies have an odious habit of not telling the whole truth. With that in mind, it is perhaps best to treat these statistics as reflecting only the minimum numbers of those affected by COVID-19. The real count of the infected and the dead is likely far higher. Part 1. Outbreak. Make no mistake, this is an emergency in China, but it has not yet become a global health emergency. It may yet become one. Dr. Tedros Adhanom Ghebreyesus, WHO Director General, March 11, 2020. Chapter 1. Once upon a time in Wuhan. We have it totally under control. It's one person coming in from China, and we have it under control. It's going to be just fine. President Donald Trump, CNBC interview, January 22nd, 2020. It began in China. It began with a single person. In the fall of 2019, Wuhan, the capital city of Hubei province, in the center of the world's most populous country, was a place few people outside the People's Republic had even heard of. Within a few months, it would become forever synonymous as ground zero for the greatest medical emergency of our age. Nobody could have guessed the coming notoriety that November, however. The sun was shining, the sprawling city's 11 million people were, as usual, thronging the streets, parks, and markets. Golden October, as the Chinese call fall, had passed, and if the people of Wuhan were preparing for winter, they were doing so with little out of the ordinary on their minds. Winters in central China tend to be relatively mild, and at the end of them comes the Chinese New Year holiday, a time of intense celebration, during which some 450 million people travel across the country. As a major transportation hub, Wuhan could expect at least 15 million to do so via the